Good evening, you're watching Trending Tonight with me, Sanket Upadhyay. So what is happening is that because of Omicron, there is a global travel chaos which has been triggered. Omicron has triggered a global travel chaos. 2 years into the pandemic, our main question is, why are we still fumbling in our response? I mean, this is exactly what we were doing in March 2020. Have we learned nothing? All the procedures that have been put in place, they are leading to so much chaos that it almost appears like a situation where there is a new variant, but an old panic. And this is not a phenomenon restricted to India. It's happening across the world. Why have we fumbled in our response 2 years into the pandemic? Let's first take a look at what the WHO says. It has issued a travel advice. The WHO says in a statement that over 60s, vulnerable, should be advised to postpone their travel. Those with comorbidities, example, heart disease, diabetes, should be advised to postpone their travel. Now, what is the age group which is being affected by Omicron? Over a third of those affected by Omicron are in the 20 to 39 age group. So it's not really, the 60 pluses or people who are old, but even those between 20 and 39, and a large chunk of the travelers who are actually being affected this time around. At least that is what the initial data suggests. Now let's give you passenger accounts of what they felt at the airports in India. When they came back, they said that the airport itself feels like a hotspot. This is an international passengers account. They say it takes around 5 hours to get out of the airport. Had to pay 3,500 for the rapid test, waited for 90 minutes for the report. Long queues for testing, 1 to 2 hours waiting time, 7-day quarantine stamp on boarding pass, but there were no follow-ups. In a situation like this, how effective is this entire exercise? Yes, nobody is building a case that we should have no attempt at trying to figure out or attempt to stop the entry of this new variant. But we should definitely ask ourselves, is this an effective way? Now, what do the authorities say on the chaos at the Delhi airport? We've got a statement that came in today that the Delhi airport is enhancing infrastructure to manage screening norms. The number of passengers pre-booking tests on arrival are going up each day. More passengers are opting for rapid PCR over regular RT-PCR tests. Installed 120 rapid PCR test machines, 20 counters for passengers who pre-booked these tests, expanded the seating arrangements for those awaiting these test results. But still, a chaos definitely there. So then we come back to the question that we are asking, that is this a case of a new variant but an old panic where Omicron has triggered a global travel chaos? We're experiencing that in India also, and we ask this question 2 years into the pandemic, why are we still fumbling in our response? I would like to introduce Dr. Sumit Ray, Head of Department, Critical Care Medicine, Holy Family Hospital. Dr. Murthy, he's a consultant in intensive care medicine at the University Hospital at Warwickshire. Thank you very much. Dr. Shashank Joshi, member of the COVID-19 Task Force in Maharashtra. We also have Subhash Goyal, President of the Confederation of Tourism Professionals of India, and also the Chairman of STIC Travels and Air Chapter Group. Thank you very much. Let me first begin with you, Dr. Murthy. Dr. Murthy, this is a global phenomenon. We are seeing chaos at airports, not just in India, but across airports. People have their respective stories to tell. I would like to ask from you, and we have had some experts who say that the manner in which we are introducing these travel restrictions are extremely arbitrary and they're not necessarily going to help. For instance, America has stopped or has imposed travel restrictions from Africa. Easy to do, but has not imposed these similar travel restrictions from Europe. Difficult to do. However, there are more cases now in Europe.
Good evening, Mr. Sanket. Good evening to my fellow panel members. If I this is quite a critical situation. I'm not able to really support or criticize the government of the UK's situation, but I can put in a couple of sentences what they've actually had to do. First of all, as soon as they've heard, the SAGE committee, the Scientific Advisory Group for Emergencies, has actually advised that because this is coming up with unprecedented exponential growth of infectivity, and our values are sky high, and they first heard in South Africa, they met and they had a conference, and their main decision is we will have to do something before it hits the shores. Now you can say obviously the vaccination program is very successful in the UK, so there would have been some comfort. Nevertheless, they felt that because of the unknown, this particular variant, which carries so many characteristics with such high rapid infectivity, although it is low pathogenicity, in other words, severe disease producing capability is less, but clearly there is a possibility that there are vaccine evading capabilities, or actually immune evasion capability from natural infection or actually immunization. So therefore, they need to pause and take swift action. So therefore, they suggested the additional measures. One of the other, without justifying for their actions, I will now give you the criticisms of why, first of all, the criticism came from within. Number one, SAGE scientists, nevertheless, although they said we should take this draconian measure, they also were vexed by the government's lack of reimposing mask, social distancing, etc. If I give you a quick illustration, in July, on 19th of July, when Mr. Johnson declared Freedom Day, nonchalant, from then on until now, we have 5 million new COVID Delta cases. And we have lost 16,000 people in that. And our ICU has been extremely busy with that. So the scientists are saying, whereas we recommend you to take these travel actions now with the Omicron's unknown situation, we are also vexed at you, i.e. the government, for not really going back to the public and taking a lot of, because the government is very reluctant approaching Christmas to actually impose any restrictions.
I think that's a significant point that Dr. Murthy seems to be making. But Dr. Joshi, I want to come to you now. You see, there will be a common opinion that, anything that is being done at an administrative level, what does that have to do with the doctors? You see, the thing is that if we do not manage the new variant well, eventually that is going to lead to increased number of cases and thus a burden on our healthcare system. I want to know from you, Dr. Joshi, that from our experience over the past 1.5 to 2 years, is this the best that could have been done in order to contain the new variant? Or what effective way could we have deployed to contain this variant? I ask you this because even in India, you've got a Maharashtra airport which has a different set of rules. You've got Delhi which has a different set of rules.
To understand that, we need to understand that community transmission of this Omicron strain has only occurred in South Africa. Rest of the world, the transmission is sporadic or travel related. Secondly, the rules differ all over the world. Hong Kong, independent of Omicron, was having mandatory 21-day quarantine, 14-day at institution and 7-day at home. This is mandatory. So, and this has been there throughout the last 20 months. So they have been very uniform in their quarantine policy. As far as India has been concerned, we have opened up and we have tried our best in the circumstances which are available. In Mumbai, we were initially thinking of a 7-day quarantine from high-risk countries and followed by vigilance on them after that. And for the non-high-risk countries, a home quarantine. However, having said that, it is not easy and it is not practical for administration to follow it. Airports have become testing labs, and these testing labs have to be done efficiently to ensure that there is minimum time which is spent on the airport. But the real journey in public health is once the person exits the airport and how well he is tracked. And current experience, whether across India, we have seen that the tracking and tracing has happened appropriately, but there is a possibility that some cases might have got missed out. We saw what happened in Bangalore, for example. We saw that the person even landed back in Dubai. So obviously this is work in progress, it needs streamlining. Ideally, a swab should be taken and the person should be supervised. And only when the report is out, he should be moved out. And there should be an appropriate air ventilation strategy. There should be appropriate masking. They should be ensuring that there is safe distancing. And our airports do not have that type of a space which is available. So they could be taken to another place where all this could be done in a very staggered, systematic and appropriate manner. So that is something for administration to handle, and it can be done better. And I think it will be done better. Having said that, we need to recognize that currently whatever is happening and whatever are the sporadic incidences of cases which are observed in countries like India, they are all coming from outside of India. So this is a point of filter which needs to be tackled well. And not just that. I think what concerns me is after the person exits at home quarantine, that is why the Bombay Municipal Corporation has come out with the guidance that person will be contacted 5 times a day by the administration for the next 7 days to ensure how well the person is, does he develop symptoms, and they will have RT-PCR tests done subsequently.
Sure.
That is equally important. Also, we need voluntary participation from citizens or inbound travelers and their family members to ensure that safety of India is assured and safety of the world is assured. Because this has to be also voluntary. There is no need to break the system. In India, also people who come in, they try to break the system, and that also should not happen.
No, should not happen. Correct. Okay. Before I come to you, Dr. Ray, Subhash Goyal, from the being a president of the Confederation of Tourism Professionals of India and also the chairman of STIC Travel, what have tourists, passengers told you? I mean, surely the experience can be made a little better, no?
Yeah, I'm in touch with a lot of passengers. Even today, some passengers, friends of mine, landed from Singapore to Delhi. See, the situation is very simple. I mean, one, I agree with Dr. Joshi that yes, that this is a disease that needs to be contained. Having said that, keeping people in the holding area for 5 or 6 hours, and if one of the person is negative before his report comes, he's going to spread the disease more, and I'm sure doctors will agree with me. So what is being done? I mean, I always repeat the example of Singapore because I just came here 2 days back. First the immigration customs has to be done first, and then outside the airport, the area where, the visitors launch, which is very big, I'm talking about Delhi airport, there about 100 booths can be set up for doing the testing. And as Dr. Joshi was saying, that we are monitoring the people at home, then what is the point, sir, in keeping them for 5 hours or 6 hours? You give the test and send them home, keep monitoring them. In here, we have a tracking system on our phone. Even now, I mean, whenever I go to any place, see, they say for 24 hours home quarantine. Once the test is negative, then after 4 hours, they telephone me, you can move anywhere as long as you're wearing the mask. If you don't wear the mask, you'll be fined. And if you still don't do it, you'll be jailed. So the law has to be strictly implemented. You see, here, I mean, we have one of the world's best airport. Hardware is good, but the software is zero. You see, we are doing, if a flight which is coming from a negative country, you want to do the test first, the whole immigration gets choked, the whole customs get choked, and a chaos is created at the airport. If you do everything smoothly, it took me 42 minutes exactly to do my immigration, customs and the COVID test. And I was home. But yes, my tracking device was there. They called me. I cannot leave the room. in which I am, they have the system. And after 3 or 4 hours, they call me, sir, your test is negative. You're free to go. So the problem is holding the people. I don't understand. If we can track them after 7 days, why can't we track them immediately after the test is over if the test is negative? And yes, there are black sheep. There are people who will, if you have to cross the road,
try to evade systems
on the green light, and if you do it on the red light, you're bound to die. So those people will suffer. And there should be strict penalties of people who do not follow home quarantine, because today we have a system.
Okay. Do stay with us. Dr. Ray, I want to come to you now. See, the pressure this is going to put on systems is a lot. And thus I ask you this question, that how important is it to make sure that the process of detecting a new variant at the airport itself or somewhere around the airport or a different facility becomes very important. For instance, a lot of people say that the air conditioning at the airport could perhaps, become a facilitator of this variant or the virus. To all those people who have not even come into contact or have not even gone abroad, what if they're taking a domestic flight?
What about the staff working at the airport?
Dr. Ray.
Yes, so yes, I think I agree with you that, these elements, as Dr. Joshi said, that the logistics of running this better is absolutely necessary to improve upon them. Even the air conditioning system, how many cycles of air exchanges should be done, should be increased in this situation in the airport. And having a better system of moving people who are being tested into areas where they can wait, as was said, and some who are coming from less at-risk nations, could they be sent home and tracked, as Mr. Goel said? These are all possibilities which should be looked at. To also remember that along with this, one is checking that our usual, we have to hunker down again as a people to get back our, COVID appropriate behavior back. I know and understand that all of us are a little tired, but we have to get back to it again, realizing that this is a new threat which has come. Along with that, as you said, the logistics have to be put in place, improved, and I think it's a work in progress, but needs to be hastened fast, because again, the airport should not become the source of infections again, the spread of the Omicron variant too.
All right. Yes, Mr. Goel, I believe you were saying something.
Yeah, what I was saying is, Dr. Joshi, since you're looking in Maharashtra, are you in like Delhi holding people there in Maharashtra also till the test result comes? Or you're letting them go? Because I don't understand the logic of holding people for 4 hours or 6 hours till the test result comes. Because if the person whom you have tested, even if one person is positive, he's going to spread the disease, because he's going to eat at the airport, he's going to use the toilet, he's going to touch the facilities. So you have to...
and the one thing that we can see in these pictures is that social distancing is a scarce commodity. One cannot see any form of social distancing at the airport. Obviously, when there will be a heavy rush, social distancing will become a casualty. Dr. Joshi, would you like to respond?
I will respond to that. See, the Government of India guideline mandates that till you don't have a negative RT-PCR report, you can't leave the airport. So what we have done is, being mindful of this, we have put, as Dr. Ray said, air ventilation in place. We have staggered them in a different place, so you're not seeing these type of pictures from Mumbai airport. And we have tried to hasten the transit for waiting for the RT-PCR. We are trying to have a faster turnaround time so that people exit the airport as early as possible, as quickly as possible. And you are absolutely right when you say that if there is a single positive and he by mistake, when he comes from a long flight, unmasks and spreads it out, it can actually be a spreader event. So we do not want airports to be spreader events. We are mindful of it, and the MAIL, which is the Mumbai airport, is very, very mindful of it. So they have made special spaces where these wait times are there. Some people can't afford the rapid RT-PCR because that is 4,500 or 3,900. And wait for a regular RT-PCR, which is of 600 or 800 rupees. So they are also put in a separate cubicle altogether. So there has been a segregation which has been put in place till such time we have better guidance. But as I said, that if you take a swab and move them out, that will make life easy The only challenge is tracking and tracing these people. There has to be an administrative mechanism to be put in place so that it becomes easy. In Singapore, tracking and tracing is easy. So I think the administration will have to iron out a policy which will make it easy. At the same time, we do not make the airport a spreader event.
Absolutely. Let's just hope that the airport itself does not become a super spreader event. While we are trying to look for a solution, we don't end up creating a problem. Thank you very much, gentlemen, for joining us. Let's move on now. The Union Territory of Puducherry has made it mandatory for all people to get the COVID-19 vaccine with an aim to achieve 100% or 100% coverage, and has said that those skipping it would face penal action under law.
A day after Puducherry made COVID vaccinations mandatory, 46-year-old Guna, a mother of 3 children, is adamant she won't take her COVID jab. Health workers tried to convince her, but to no avail.
நிறைய பேர் என்ன சொன்னாங்க ஊசி போடணும்னா தான் இறந்துட்டாங்க அப்படின்றாங்க. நாங்க எதை நம்பி நாங்க என்ன செய்ய முடியும் தான் பார்க்கறோம். ஏன்னா 3 பிள்ளைங்க இருக்குது. எங்களுக்கு வேற யாரும் கிடையாது. யாரும் நம்பி நாங்க பிள்ளைங்களை விட்டு போக முடியும். ஊசி போட்டு எதனா ஆயிடுச்சுன்னா நாங்க என்ன பண்ண முடியும்? அதுதான் எங்களுக்கு இஷ்டம் தான் நாங்க போட்டுக்கறோம். அதனால தான் நாங்க பயப்படுறோம்.
The Puducherry government has invoked the Puducherry Public Health Act 1973 to make COVID vaccines compulsory. So, 500 health workers are on a door-to-door screening to get everyone vaccinated. It's not easy to convince everyone. Vimala has managed to convince this hesitant lady, Vadivu.
இப்ப தயாராயிட்டேன். போட்டுக்கலாம்னு வந்துருச்சு இப்போ. எப்ப போடுவீங்க? அடுத்த வாரம் போட்டுக்குவேன். உடம்பு சரியா இருக்கு.
This college student says he had managed to evade getting vaccinated so far, but today he took his first dose.
அவங்களே வந்து நம்மள தேடி வந்து போடுறாங்க அவங்க ஊசி. ஆனா கொஞ்சம் பயம் எதுவும் இல்ல.
Only 49% of Puducherry's 10 lakh eligible population is fully vaccinated, though 75% has taken the first dose. With Omicron variant triggering fears of another wave, the administration says this is only a strategy to boost inoculation. They agree they cannot force anyone to get vaccinated.
Keep our Puducherry people safe. We are insisting on 100% vaccination. It is their right to get vaccinated, but this act may help to increase the vaccination.
Even as mandatory vaccination raises questions on an individual's right, Puducherry isn't taking chances. Soon it plans to deny entry to the unvaccinated into parks like this and other public places. In Puducherry with Palaniswamy and Suresh, Sam Daniel, for NDTV.
103 children's staff have tested positive in a school outbreak in Karnataka. The Karnataka government school has called it a major outbreak. Remember, this is the same state where the first few cases were reported of COVID becoming a sort of a super spreader event. Let's take a look at this report.
In Karnataka, Bengaluru is seeing the biggest rise in cases, with over 1,200 cases in the past 1 week, an increase of 18%.
The city saw India's first 2 Omicron cases, but this has not yet been linked to the rise. Cluster outbreaks have been reported in other places such as Mysuru, Dharwad, Kodagu and Shivamogga districts. What is common are outbreaks in boarding schools and colleges. Health officials have called for new guidelines, but the government says it's not alarming.
That is the reason Government of Karnataka has given a guideline, and those who are in colleges, hostels, particularly hostels, so these RT-PCR tests need to be done once in 15 days, irrespective of the symptoms.
It is not an alarming thing, but as expert has told, it will become very serious. So we have taken all extra measures.
The latest cluster outbreak has been reported on December 5th, on Sunday from Chikmagaluru district of Karnataka. Nearly 103 persons, including 92 students, 9 staff, 2 are the parents of the staff that have tested positive at Jawahar Navodaya Vidyalaya. While cases have seen an uptrend, the good news is that no severe cases have been reported. but the maximum caseload has been students between the age group of 18 to 20. The minister in charge blames students coming in from Kerala.
It is between around 18.
18 to?
18 to 20. PU major is from PU colleges.
Though at least 5 COVID clusters have been reported in the last 2 weeks, the Education Minister said it does not call for closure of schools and colleges. Students contribute major chunk of COVID cases in the state of Karnataka. However, the government is of the opinion that the situation is not alarming. The government now looks at ramping up the testing from 1 lakh to 2 lakh every day. In Bengaluru, with camera person Govind Murthy, Shrija for NDTV.
All right, news continues on NDTV. Stay with us.